responsive information management system, and community feedback mechanisms to first 1,000 days population. Information management is crucial in our targeting and monitoring and evaluation activities for the nutrition program. Given this, a system needs to be in place that integrates all essential data collected at the local level, especially those relating to the first 1,000 days of life. A competent staff must be assigned to consolidate and manage these data. Data also needs to be processed into information and disseminated accordingly to stakeholders, including communities, for appropriate feedback. One approach for community feedback is by doing the malnutrition review or through organized dialogues with partners. Competent LGU officials and staff in nutrition governance. A concrete example of improving competencies of LCEs and teams towards nutrition governance is the Provincial Nutrition Governance Program, or PNGP, of ZFF, as well as other capacity development programs of the NNC. Apply coaching and mentoring methods to introduce and guide participants in implementing quality nutrition programs. A way of ensuring sustainability of the process is by organizing a pool of trainers that will also engage or train other members of the LGU and barangay level in leadership and governance activities for nutrition.
In Pilar, we strongly advocate for evidence-based approaches in our planning, budgeting, and programming for health and nutrition. We firmly believe that having a reliable and timely data source is paramount to achieving our goals in these crucial areas. That's why we're thrilled to announce the introduction of the Health and Nutrition Information System this year. The HNIS represents a significant step forward for us, as it integrates all pertinent nutrition-related data and information into one accessible platform. This means that stakeholders at every level can easily access and utilize the wealth of information at their fingertips. To ensure the successful implementation of the HNIS, we've invested in training for our dedicated health workers and volunteers. They have been equipped with the necessary skills to effectively utilize the HNIS tool and have already begun applying it in their respective barangays. Furthermore, I'm proud to share that our local chief executive has shown unwavering support for this initiative. This demonstrates our commitment to leveraging technology and data-driven approaches to enhance the health and well-being of our community.
The ODK is one of the modules of our Sarangani Health Information and Management System. This is the profiling component with about 300 questions being profiled by the BHW and with geotagging. It has the social determinants of health, and with a click in the system, you can see households without sanitary toilet. You can see households whose water source is spring. You can see households whose family members are not yet registered or updated in PhilHealth. The data derived from this is giving us analytics like in the recently profiled 228,000 individuals, there are about 824 malnourished children 0 to 59 months old. And in fact, about 50% of these malnourished children with 3 phases of malnutrition, their family income per capita is actually less than 5,000. Hence, our nutrition interventions are data-driven and scientific-based because of this ODK profiling.
The annual report for Operation Timbang Plus is crucial for evaluating the impact of nutrition interventions, establishing baseline data, and aligning future plans. Inaccuracies during data collection can lead to misinformed assessments and ineffective program implementation. The Sarangani Provincial Nutrition Unit conducts yearly inventories of functional and calibrated height boards and weighing scales to maintain data accuracy. Through the Municipal Nutrition Action Officers and deployed nutritionist dietitians, our barangay nutrition scholars were trained to facilitate the correct height and weight measurements. To ensure the accuracy of the reports, our deployed Provincial Nutrition Program Officers and deployed DOH nutritionist dietitian, the Municipal Nutrition Action Officers validate and do random checks of the said reports before submitting them to the Sarangani Provincial Health Office. In Sarangani Province, the Provincial Nutrition Evaluation Team conducts the annual monitoring and evaluation of program implementation. One of the indicators is focusing on the competency among health and nutrition workers. We assess training needs through a yearly inventory of barangay nutrition scholars. Identifying training gaps become priority funding for the province, while others are recommended to the municipal nutrition units for inclusion in their budgets. This ensures continuous support and enhancement of nutrition workers' skills at all levels. Under the visionary leadership of Governor Rogelio Pacquiao Sr., we are committed to achieving no new stunting by 2025. Families with malnourished children and pregnant women with low BMI are now a top priority. Thanks to partnership with CL Foundation Incorporated, Mahintana Foundation Incorporated, and DSWD Cash for Work program, we are making strides. Our Tugon sa Gutom program, in collaboration with CL Foundation Incorporated, empowers families in Alabel and Maasim through sustainable agriculture and household food security. Meanwhile, our Nutrition Bakery, in partnership with Mahintana Foundation Incorporated, provides nutritious breads for daycare centers, schools, and community-based feeding programs. With an initial investment of 500,000 pesos, we launched our first bakery center in Alabel last November 2022, and this year we are expanding to Kiamba. Together, we are nourishing bodies and spirits, one initiative at a time.
During Module 1 of the Municipal Nutrition Governance Program, it was emphasized that the nutrition system in the grassroots level should be strengthened because the Barangay Nutrition Council is a driver of community participation and they initiate action to promote health and nutrition. Then a training of trainers was conducted by the Caraga National Nutrition Council on nutrition program management training. They focused on effective planning and ensuring that strategic investment in nutrition initiatives should be in place. So the Municipal Nutrition Council of Santa Monica gathered themselves up. They organized a rollout of the Barangay Leaders Program on Nutrition Security. As part of the Municipal Nutrition Governance Program, Nutri-Heal Runway. They emphasized the importance of bridging leadership, of strengthening yourselves, open minds and open hearts, and having open minds and open hearts. And so it resulted in revitalization of the barangay nutrition councils in the 11 barangays in Santa Monica. They were reactivated and they formulated a barangay nutrition plan. These barangay nutrition plans are the solid foundation for sustained progress in our initiatives in the nutrition system in Santa Monica, Siargao Islands, Surigao del Norte.
Nang dahil sa series of trainings on BL Nutrition Governance, lumawak ang aming kaalaman, pati na rin ang natutunan mula sa iba't ibang mga LGUs at ang kahalagahan ng mga pagkakaroon ng policy o polisiya upang manatili ang mga barangay nutrition scholars at barangay health workers. Acknowledging the crucial role of BNSS as frontliners, last September 2023, we passed an SB resolution to retain the BNSS and BHWs. Sa tulong nito, na-empower ang aming mga community health workers. Hindi na rin masasayang
ang aming resources sa pagpalit-palit ng mga BNS at BHWs. Ang tagumpay na ito ay bunga ng suporta mula sa municipal mayor namin.
Bilang midwife dito sa Bubon, hinahawakan ko din ang mga PHS maliban sa nutrition program. Pero para mas mabigyan ng focus ang problema ng malnutrition sa Bubon, ginawa akong isang full-time IMNAW. The mayor pushed for the establishment of a full-time IMNAW to ensure effective handling of nutrition programs. This initiative aims to concentrate the efforts of the Municipal Nutrition Office on implementing programs and policies geared towards reducing malnutrition within the municipality. Ito ay may kasamang appointment signed by our mayor. Ngayong isa na akong full-time IMNAW, nagkaroon ng mas epektibong pamamahala sa nutrition program. Mas nakafocus na ako sa supportive supervision at coaching sa mga PNS at BHWs. Mas maraming oras ang nailalaan sa pagpaplano, pagpapatupad at pagsusuri ng mga nutrition interventions ng munisipyo. Naging mas madali din ang koordinasyon at komunikasyon sa iba't ibang sektor at ahensya. Ito ay nagresulta sa mas integrated na pagpapatupad ng mga programa. Bukod dito, mas nabigyan ako ng oportunidad na mas mapalakas ang aking kakayahan sa pagtuturo at pagbibigay ng suporta sa mga barangay nutrition scholars at barangay health workers. Mas marami na akong pagbisita sa mga barangay na nagagawa para mas mapaigting ang pangangalaga sa kalusugan at nutrisyon at mapaunlad ang aming komunidad.
Learn more about the 8 critical knobs for nutrition in our succeeding Facebook series. Stay tuned! We are also inviting you to watch Learning Forum on Responsive Leadership and Governance for Faster Health and Nutrition Outcomes on May 21, 2024. Scan the QR code or click the link in the description to register.